In this video, we are discussing the effect that menstruation can have on acne. The average menstrual cycle is 28 days, and each of these days is different hormonally. In the first half of a woman's menstrual cycle, the predominant hormone is estrogen. In the second half, the main hormone is progesterone. During the menstrual cycle, levels of the hormone estrogen fluctuate in a woman's body from around day 14 until when the period is due. Estrogen levels in the body decrease, resulting in a proportionately higher level of testosterone. This imbalance in the hormones can result in testosterone connecting to receptors in the skin more freely and increasing the size of your sebaceous glands as well as the amount of oil that they produce. This, in turn, can lead to an increase in blockages of your hair follicles and a subsequent increase in acne. Acne-prone women experience these premenstrual flares. They usually strike about 7 to 10 days before the onset of a woman's period and then subside as soon as bleeding begins. This is what you can do at home to prevent acne. Try to do good facial hygiene with gentle non-soap cleansers.
Wash your face twice daily. Use gentle non-soap facial skin cleanser like Cetaphil. Use warm water but not hot water. No vigorous washing or scrubbing. Do not pick or squeeze pimples.
If you start to develop mild acne, there are some over-the-counter products that can be helpful depending on the type of acne. There are various different treatments that can be effective. The main types of acne are comedonal acne, which is basically whiteheads and blackheads.
Whiteheads, or closed comedones, are skin-colored filled with dead tissue. Blackheads, or open comedones, comprised of oxidized lipid, melanin, and dead skin.
Most commonly treated with topical preparations like adapalene.
Different Gel is a good product with adapalene. There are many products worldwide, and you can try a gel with adapalene available in your country. This stuff you can get without a prescription. You must know how to apply. Get a pea-sized amount on your fingertip. What we have to do is make a thin film that will cover the entire face. One for the forehead, one for the right cheek, one for the left cheek, and one for the nose, and the last one for the chin. Then gently apply the cream to make a thin film. Do not rub vigorously, be gentle. You can apply this at night before going to bed. So I recommend you use it every other night with adapalene. We are alternating 2 gels at night. What will it do to your blemishes? Your excess oil and sebum will be swept away. One of the harmful things is dead skin blocking the pores, which will be addressed by adapalene. It will target the bacteria inside your pores, which leads to painful pus-filled bumps. These are the cause for most pus-filled blemishes, so we are clearing them up. The easiest way to remove blackheads and whiteheads is to extract them with a comedo extractor. It's the easiest method, and you can do it yourself. Benzoyl peroxide wash after the procedure as an antibacterial agent.
Inflammatory acne, which are more inflamed, deeper papules. Topical prescriptions and commonly oral antibiotics are used to treat inflammatory acne. Nodular cystic acne is much more severe, bigger, tender, painful nodules that can cause scarring and can require more significant forms of treatment.
5% benzoyl peroxide gel. Acnicide gel and Pirigo gel are common brand names. There are many products worldwide, so you can try a gel with benzoyl peroxide available in your country. Containing benzoyl peroxide. I will list all drugs I describe in this video in the description box, so you don't need to write them now. You must know how to apply and get a pea-sized amount on your fingertip, which we have to make a thin film to cover the entire face. I'll show you how to do it. One for forehead, one for right cheek, one for left cheek, one for nose, last one for the chin. Gently apply the cream to make a thin film. Do not rub vigorously, be gentle. You can use this at night before going to bed. So one common side effect with benzoyl peroxide is a burning sensation. But most of the time it's due to the application of too much gel. See how she applies it? Oh, too much. You will understand why most get irritation and redness. You will be confident with my method. Try it and let me know. What will benzoyl peroxide do for you? It will target the bacteria inside the pores, leading to painful pus-filled bumps. These are the cause of most pus-filled blemishes, so we are clearing them up. Your excess oil and sebum will sweep away. One of the harmful things is dead skin blocking the pores, which will also be addressed by benzoyl peroxide. It will clear your breakouts for sure. Comment below on how this works for you. It has worked for thousands like you. Its results are apparent in 2 weeks, and you will notice a drastic reduction in existing blemishes, reduction in new. It's safe during pregnancy, so there's no need to worry if you plan for pregnancy. Safe for both males and females. And if a large area is affected, like the chest and back, I recommend you use 10% benzoyl peroxide wash in the morning in addition to our routine. 0.1% adapalene gel is the next option. Differin gel is a good product with adapalene. There are many products worldwide, and you can try a gel with adapalene available in your country. This stuff you can get without a prescription. You must know how to apply. Get a pea-sized amount on your fingertip. What we have to do is make a thin film that will cover the entire face, as we did with the benzoyl peroxide. One for the forehead, one for the right cheek, one for the left cheek, and one for the nose, and the last one for the chin. Then gently apply the cream to make a thin film. Do not rub vigorously, be gentle. You can apply this at night before going to bed. So I recommend you use it every other night with adapalene. We are alternating 2 gels at night. What will it do to your blemishes? Your excess oil and sebum will be swept away. One of the harmful things is dead skin blocking the pores, which will be addressed by adapalene. It will target the bacteria inside your pores, which leads to painful pus-filled bumps. These are the cause for most pus-filled blemishes, so we are clearing them up. You will get a clear face with these steps for sure, and it's guaranteed. Results will be more rapid if we combine both. But we have to do a few other things. A good cleanser is crucial to preventing breakouts. You must get a good one to have results. Cleansers formulated with salicylic acid and glycolic acids, the best ones in the United States and Europe, are Cetaphil Acne Cleanser, Effectla Salicylic Acid Cleanser. Wet your face with lukewarm water. Use your fingertips and gently apply to cleanse. Don't rub vigorously. Don't scrub the skin. Pat dry with a soft towel. Limit washing to twice a day and after washing daily. You can try a good cleanser available with salicylic acid and glycolic acid in your country. It deep cleans to clear breakouts, remove dead skin, reduce bacteria, and unblock your pores. It starts to work immediately to reduce your blemishes. You can cleanse twice daily to avoid overwashing, and after cleansing, you can apply benzoyl peroxide or adapalene at night. So these are my secrets. You can try it and share your experiences with me. If you feel troublesome switching to benzoyl peroxide and adapalene alternatively at night, you can have a gel like a P-Duo gel. It has benzoyl peroxide and adapalene so that you can use it every night. It is less troublesome for you. Adapalene is not recommended in pregnancy.
Oral antibiotics with or without oral retinoid, known as isotretinoin, can be used. Doxycycline or azithromycin is the preferred antibiotic.
Hormonal acne, which is mainly seen in adult women and is related to their menstrual cycle. This requires a different form of oral medication, like contraceptive pills and anti-androgens. If you try over-the-counter medications and don't get benefit, or if you feel like you have a more severe form of acne, it is very worthwhile to see your physician. Thanks for watching. Make sure you subscribe to my channel. See you next time. Bye!